it's Dr. Tressa, and this is my little cavie, Ronnie, and she's 6.5. She's gonna have a dental today. I've already done her pre-surgical exam, and she does not have a heart murmur yet, which is great. So she's deemed healthy for anesthesia outwardly, but we did run some blood work, and her blood work looks great. So I gave her a little pre-med just to kind of calm her, and our next step will be to put an IV in her, and that's to help us administer more medications and fluids, and it just helps us have a vein access while they're under anesthesia. So just want everybody to know that age is not a disease. So if your dog is healthy otherwise and we have good blood work, then dental health and anesthesia can certainly be accomplished. All right, we're going to start induction of anesthesia. This is propofol, which is what we commonly will use. I'm going to give a little bit of that and flush it through. And then we'll actually use a little midazolam or Versed, which is what's used in people a lot of times too. So very safe drugs to administer, even if you have a very senior pet. And then, okay, which is just a little bit more. We're gonna give Ronnie just a little bit more because her jaw's a little tight. And then what we're gonna do is place an endotracheal tube, and this is primarily so we can breathe for them. And then also when we're cleaning the teeth, then we don't have to worry about bacteria going down into their lungs. So we don't want them to aspirate all that bacteria. Do is put her on her side, and then we're going to hook her up to some oxygen and start the monitoring process. All right, so there's our monitoring just starting. We've got an EKG, and she's got a normal rhythm there. We also have her pulse ox on, which is checking her oxygen saturation at 96, which is good. And she's still not quite breathing on her own yet, so I'm gonna mechanically ventilate for her. And you'll start to notice that little 8 number there, that's number of breaths per minute. And then we're also monitoring their carbon dioxide, what they're blowing out and what they're taking in. What they're blowing out is the 29, what they're taking in is the 0, and we want that to be 0. We don't want them breathing in carbon dioxide, we want them breathing in oxygen, as well as our gas anesthetic that we do have hooked up now. And Alex is just putting a Doppler on so that we can start to monitor blood pressure. All right, and Alex just placed our dental x-rays. Here's our intraoral probe. So we take digital dental x-rays, and it's immediate. So basically he'll snap a picture, and then it will show on a screen immediately for us on our little computer screen over there. When it comes up, okay. All right, so we've just shot the x-ray. And good view of all of our upper incisors there, and the crowns of the canines. We'll want to get the roots, so that's a really great picture that Alex just took of the incisors. Alright, so we've finished taking our intraoral x-rays, and I've probed all of the teeth. We want to check for pocketing, because sometimes you can find things in the mouth even without the x-rays. You really need to do both. So Ronnie's teeth look good in general, just minimal gingivitis, so she's going to be our basic scale and polish. And I don't typically send them home with antibiotics. It's not necessary. The dental specialists don't do it. You'll also notice if Mary backs up, we do have her hooked up to IV fluids too. And that's just to help keep her hydrated, her blood pressure up. It helps process the anesthetic faster as well. And now Alex is going to start scaling with our ultrasonic scaler. Alright, so now we've got Alex. Alex has already scaled the teeth, and he's just going to polish them now to smooth it out so that we can prevent further bacteria and tartar accumulation. So this is an important step in the dental cleaning as well. So he's going to polish all those real nicely. And you can see how the teeth are looking pretty clean after scaling. Another thing I did want to point out is just that the heating element we have on her too. We've got this little bear hugger, so we do worry about dogs getting too cold under anesthesia. It lowers their blood pressure. They just don't recover as well. So we do have a heating unit on, and her temperature has remained above 100 all the time, which is wonderful.